name is Karen Malcom, and I am a patient financial representative, which is a fancy term for being a biller. I get the claims out to the insurance carriers for commercial insurances and VA and search and all the other entities that people have for insurance coverage. From the time I walk into the door until I leave for lunch at 1 o'clock, I'm going and going and going. And I am actually the very end of the whole process when a patient is seen. So when they call and make their appointment and then they're seen, then charges are done and all the documentation is done, and then it all gets funneled down to me, and that's when the bill goes out. Well, I actually didn't have any training when I applied for the job here. I had worked in the medical field somewhat before in a different area, but I had been in office work for quite a while. But once I came on board, I got training in the clearinghouses and confidentiality. So I had on-the-job training mostly. I didn't go to school for this, but I do have a high school diploma, and I went to junior college for a couple of years, so that helped. Eight hours. I deal with paperwork all the time, and it's kind of ironic because we've recently gone to electronic medical records. So a lot of times we have to take copies of things so that we can scan them into the electronic medical record. The reason I deal with so much paperwork is a lot of the claims are paper. A vast majority go electronically through our clearinghouse, but the other ones like the VA and workers' comp, and say you have an automobile accident and that insurance is billed, they all need backup documentation. So there's different forms for different situations. So all of that information has to be correct and attached to the claim when it goes out. So I have a lot of paperwork, a lot. The other part of our particular office, I don't know how other hospitals work, but with ours, we have phone calls come in because people want to ask about their claims. They want to find out about all the accounts that they have, their bill that has gone to private pay. So we've got the phone ringing all the time and people coming in to check on their bills and pay. And so it's extremely challenging, but it's also very rewarding. The thing I get the biggest kick out of is in this day and age, insurance companies are very stingy. They don't tend to pay when they first get the claim. Typically an insurance company can deny out of hand, and unless the patient questions it, the patient will end up paying for it. So I go to bat for patients quite frequently, especially our lower income people that are on Medicaid, and when Medicaid doesn't pay, I navigate through that system to make it so that they either readdress it or we let that patient know that those services aren't covered, because they're not always real savvy on what Medicaid covers and what they don't. So my biggest reward is going to bat for the patient. There's a lot of different stuff, so I would encourage anybody that is interested in the medical field to investigate the different aspects of it, because there's a ton, and it's changing all the time.